No problem.
Good morning. This is Dr. Mahesh C. Gunchikar. I practice in Malaysia and Bangalore as an orthopedic surgeon. I'm basically interested in replacements and all type of fractures, sports injuries, and I do a little bit of spine as well. Yes, today we're talking about arthritis of the joints in the body, which you know obviously osteoarthritis we call it commonly, and it's a very common term nowadays. When you mean arthritis, it doesn't have to be only occurring in the older population. It can occur in the both younger population and the older population, including from the infantile age. There are various reasons for this. We could broadly classify as primary and secondary osteoarthritis. Primary is where it's genetic and we don't know primary is where we don't know the cause of the arthritis, or it might be genetic. But coming to secondary, mainly divided into 5 of them: infection, inflammatory, degenerative, trauma, and tumors. Coming to infection of the joints is very common in children, which the post sequelae of infection of the joint, which destroys the cartilage, can lead to arthritis in even infants or toddlers with destroyed joint. If not corrected, they might go into arthritis in the later years, at 10 or 20. It can be either the most common infection was tuberculosis in the past. Now it can be pyogenic, that is common organisms which cause a throat infection or other infections in the body can also affect the joints. That can lead to irregularity of the articular cartilage, which leads to arthritis if not treated well in time. The second cause, that is the rheumatoid infection. The second one is inflammation. Broadly, it is classified again into rheumatoid arthritis. Can affect any age, including less than 30 years or more than 13 years, called juvenile rheumatoid arthritis. These arthritis can lead to real bad sequelae in the future. It can be broadly classified into rheumatoid and seronegative spondyloarthropathy, which the rheumatologist will deal about. The third common cause is trauma. Trauma is also a very significant cause of arthritis of the joint, particularly if the fractures in the long bones or any of the fractures can cause irregularity of the joint surfaces, can lead to early arthritis compared to the other joints in the body. This is localized arthritis and can affect any joint in the body. The fourth one is degenerative, which we commonly talk about nowadays, which is very, very common, and where the most chunk of the population suffer from is old age arthritis, which we know that how we go about, including exercises, physio, and all the other treatment modalities, including injections into the joint, which are including PRP or GCF, growth factor concentrate, or hyaluronic acid. Very rarely, in the very older people, 80 or 90, when we can't operate because of cardiac complications, we also give steroid injections to the joints. The fifth uncommon cause is tumor. Tumor is nothing but malignancy, whether it is benign or malignant one. Commonly, the bone cancers occur very commonly near the joints, even in children. Can be affected by bone cancers, or even swellings around the joints, around the knee, very common, called osteoclastomas or osteosarcomas, common in the second decades and the third decades. This can again cause irregularity of the joint surfaces and causes degeneration of the joint, leading to arthritis in the future. So this is a very comprehensive method of covering all the arthritic conditions all over the world. Coming to the treatment aspect, we can discuss in the later video. But this is basically what the general population needs to know about the arthritis in the joints. Thank you. Thanks.